Good day, sir. My name is Dennis Mangas Jr. and I will be your student nurse for today. And I will be assessing your health and your health concerns for today. So please, I need you to cooperate because I'm going to ask you some questions regarding on your health. Is that okay with you, sir?
Yeah, that is fine with me.
Okay, that's good. So first, let me just clear something here. May I know your name, sir?
My name is Dennis Olmar de Guzman Mangakas.
Okay. Where do you live, sir?
I live at Santa Barbara, General Nueva Ecija.
Okay. How old are you, sir?
I am currently 14 years old.
Are you single or have a girlfriend or married?
I am currently single.
Okay. Do you have an occupation, sir?
I have no occupation since I am a student.
Okay, makes sense. Okay, sir, what brings you here today?
I am experiencing a strong headache.
Okay. Other than that, are you experiencing something even more? Are you feeling discomfort right now?
No, I am fine.
How about our light, sir? Is it bothering you? Is it affecting your headache?
It's normal for me.
Okay, that's good. So, overall, how would you say your general health? Are you feeling good right now,
Yes.
aside from your headache?
Yes, everything seems to be normal.
Okay. I'm going to ask you some questions regarding on your history. Would that be okay with you?
Yes.
So we can assess?
Yes, that's fine with me.
Okay. When you were a child, have you ever experienced some illness?
No,
No? Any accident or injuries?
not that I recall.
Okay. Any serious or chronic illness?
None.
Okay. Any hospitalizations?
None.
Okay, good. How about any operation, sir?
None.
Okay, that's good. Okay, we will be talking about your health history. Have you ever experienced any heart disease?
I have not any.
Okay, that's good. How about high blood pressure, sir?
None.
Okay. Uh, how about stroke?
None.
Diabetes?
None.
How about blood disorder?
None.
Do you have any allergies?
I'm allergic to puppies.
Oh, puppies. Okay. How about asthma, sir? Do you have asthma?
None.
How about alcoholism, sir? Are you
None.
drinking alcohol? Okay, that's good. How about mental illness, sir?
None.
How about seizure disorder?
None.
Kidney disease?
None.
Okay, good. So we will now be reviewing your system. Will that be okay with you?
Yeah, that's fine.
Okay, first of all, your general overall health status. Did you gain weight for the past 3 months?
Yes.
Okay. Did you experience fatigue?
No.
How about weakness or malaise?
No.
How about fever?
Yes.
Do you currently have fever?
No.
Okay. How about chills? You
No.
currently have? Okay, that's good. Okay. Uh, Skin, sir. We're now going to talk about your skin. Have you ever experienced any history of skin disease related problem like chicken pox?
I have.
You did. So when was the time that you experienced it?
About 2 years from now.
Okay. How about pigment or color change?
None.
Okay. How about change in mole?
None.
Okay. How about excessive dryness?
None.
How about excessive moisture?
None.
Okay, good. How about excessive bruising?
None.
Okay. How about rashes?
None.
Lesions?
Also none.
Okay, good. Let's talk about your hair, sir. Have you ever experienced recent hair loss?
No, not that I recall.
Okay. How about change in texture on your hair, sir?
No, also.
Okay, good. How about your nails, sir? Any change in color, change in shape?
No.
Okay. How about in brittleness, sir?
Also no.
Oh, good. Let's talk about your head, sir. Any frequent or severe headache?
Yes.
Okay. We'll talk about that later. I have a following questions for that. History of head injury?
None.
Okay. Have you ever experienced dizziness?
Sometimes, but usually it's normal to have no headaches.
Okay. How about sinus scope, faintness when you're nahihimatay po?
Wala po.
Okay. How about let's talk about your eyes, sir. How about difficulty in vision? Have you ever experienced that?
When I am tired, yes.
Okay. How about eye pain?
None.
Double vision?
No.
Redness or swelling?
No.
How about watering or discharge?
None.
Uh, okay. Let's talk about your ears, sir. How about earaches? Have you ever experienced that?
No.
What about infections?
No.
Discharge?
No.
How about ringing of the ear? Like when you're hearing "ee"?
Sometimes. Out of the ordinary, yes.
Okay. How about hear loss, sir?
None.
You use hearing aids?
No, I don't.
Okay, good. Let's talk about your nose, sir. Um, have you ever experienced severe colds?
No.
About sinus pain?
Also no.
Nose bleeding?
Yes.
So when did the bleeding occur?
I recall about last year though.
Oh, it's last year. How about in change of smell? Change in smell?
None.
Okay. Nasal obstruction?
None.
Allergic rhinitis?
None.
Okay, good. Moving on to your mouth, sir. Have you ever feel any mouth pain?
No.
How about frequent sore throat?
Also no.
How about bleeding gums?
None of that.
How about toothache?
No.
Lesions in your mouth?
No.
Difficulty in swallowing, sir.
No.
Okay, good. How about hoarseness in voice? Hoarseness in voice.
No.
Okay. How about altered taste?
No.
Okay. How about dental caries or cavities?
No.
Okay, good. Use of dentures, bridges.
None.
Okay. Use of dental braces. No. Okay. Moving on to your neck, sir. Uh, your neck. Have you ever experienced neck pain?
None so far.
And so far, have you experienced it before?
Yes, when I was about 8 years old, I think.
And why do you think that happened, sir?
I think I played too much outside, and when I came to rest, then the next day, it I couldn't move my neck because it hurt so much, and then I
Oh,
called my mom.
maybe that's stiff neck. Okay. How about limitation in motion, sir?
None.
Okay. Lumps or swelling?
None.
How about enlarged or tender nodes?
None.
Okay. Okay. Moving on to the next part. We will now be reviewing your health system like respiratory, cardiovascular. Would that be okay with you, sir?
Yes, that's fine.
Okay. Do you have any history of lung disease?
None.
How about chest pain? Do you feel chest pain with breathing?
No.
How about wheezing or noisy breathing?
No.
How about shortness of breath?
No.
Cough?
No.
Do you feel that? Do you feel... Okay, that's it. Do you feel palpitation? Moving on to your cardiovascular system. Palpitation?
No.
Okay. Frequent urination during night?
No.
Good. How about edema?
No.
History of heart disease?
None.
Hypertension?
None.
Anemia?
None.
Okay, good. Uh, Moving on to your peripheral vascular system. I'm sorry for that. Uh, do you feel coldness, numbness, or tingling, swelling of legs?
None.
Good. How about discoloration of hands and feet?
Not that I recall. No.
Okay. How about varicose veins?
None.
Okay, good. How about pain on legs when walking?
None.
Okay. Ulcers in lower extremities?
None.
Okay, good. Moving on to your gastrointestinal system. Um, have you ever experienced loss of appetite?
No.
Okay. How about food intolerance, like when you are lactose intolerant?
No.
Okay. How about heartburn, sir?
No.
In indigestions?
No.
Uh, have you recalled any pain associated with eating?
No.
Okay, good. Moving on to the next part. Have you ever feel abdominal pain?
No.
Okay. How about nausea or vomiting?
None.
Uh, did you have any history of abdominal disease?
No.
Okay. How about constipation, sir?
None.
Diarrhea?
None.
Black stool
None.
in your... Okay, none. How about rectal bleeding, sir?
None.
How about hemorrhoids?
No, I don't. None.
Have you ever used antacids?
No, I haven't.
How about laxatives?
No.
Okay, good. How frequent do you usually urinate, sir? Moving on to your urinary system.
About 8, 9 times a day.
Okay. Um, do you have a specific number of urinations when you wake up at night?
No.
Okay. How about difficulty or painful while peeing?
No.
Okay, good. How about excessive amount? Do you urinate more than 1,500 milliliters per day?
No.
Okay. How about decreased amount? Do you urinate less than 30 milliliters per hour?
No.
Okay, good. Uh, have you ever experienced narrowed stream of urine?
No.
How about change in color, sir?
No.
Okay. Moving on to your male genital features. Um, have you ever experienced penis or testicular pain?
None.
Okay. How about sores or lesions?
None.
Good. How about penile discharge, sir?
None.
Lumps,
None.
hernia.
Also. None.
Okay, good. Moving on to your muscular system, sir. Um, as you said earlier, you don't have history of arthritis, right?
Yes.
Gout.
None of that.
Okay. How about pain, stiffness, and swelling of joints? Have you ever experienced that?
No.
Okay. How about joint deformity?
No.
Okay, good. Moving on to the next part, sir. Any limitation of motion joints?
No.
Noise with joint motions?
No.
Okay. Muscle pain, cramps?
Sometimes, but not all the time.
When is the time that you're experiencing muscle pain and cramps?
Usually when I move a lot in a singular day, non-stop, no rest.
Okay. How about muscle weakness?
None.
Problem with walking?
No.
Okay, good.
None.
How about back pain, sir?
None of that.
Okay, stiffness and limitation of motion muscle?
None.
Reserve disc disease, sir?
None.
Perform exercise, example, walking, aerobics. Are you doing some exercise, sir?
Not in the past week, no.
Okay. Uh, Have you ever experienced difficulty in performing daily activities?
No,
Okay, good. Have you ever used wheelchair, walker, something like that?
I haven't.
Okay, good. Moving on to your logic system, sir. Um, History of seizure disorder, according to you, you have none of that, right?
Yes, that's correct.
Okay. History of stroke.
No, none.
Okay. History of fainting or blackouts.
None.
Weakness in any body part.
None.
Okay. Tics or tremor.
None.
Paralysis, sir.
None.
Coordination problems.
None.
Uh, Paresthesia,
None.
or also known as numbness and tingling.
Also, it's a no.
Okay, good. How about memory disorder, sir? Have you ever experienced any of that?
No, not in my entire life.
Okay, that's good. How about disorientation, sir?
None.
Okay. Nervousness?
Hmm. None.
None. Okay, that's good. Mood change, sir? Have you ever experienced any of that?
Hmm. Not that I can recall.
Mood change, okay. Depression, sir?
None.
Ever feel depressed? Okay, that's good. Nowadays, our mental health is very important. History of mental health dysfunction, sir?
None.
Hallucinations?
Also, none.
Okay, moving on to your hematologic system. Have you ever experienced bleeding tendency of skin, mucous membrane?
No.
Excessive bruising?
No.
Lymph node swelling?
No.
Like the nodes here on your face? Okay, no. Exposure to toxic agents or radiation?
No.
Okay, good. Blood transfusion?
No.
Okay. How about reaction to blood transfusion, sir?
No.
Okay. History of blood disorder like anemia, leukemia.
No.
Okay, good. Moving on to your endocrine system, sir. History of diabetes.
I have none.
Okay. Excessive urination, according to you, none.
Yes.
But excessive thirst, sir.
Um, no.
Okay. Excessive hunger.
None.
History of thyroid disease.
None.
Okay, good. How about intolerance to heat and cold? You have any
None.
of that? Okay. How about change in skin? How about change in skin pigmentation or texture, sir? Experience any of that?
None.
Okay, good. Excessive sweating, sir?
None.
Good. About weight gain with loss of appetite, sir?
None.
How about weight loss with increase of appetite?
None.
Nervousness?
Also, none.
Okay, tremors, enlarged goiter, none. Uh, okay. Others. This next question, sir, is I'm going to ask you how do you deal with stress with your life and what stresses you in life, sir? Is that okay with you?
Yes, that is fine.
Sir, what do you think is the problem where you are getting stressed in life? Is there any?
Um, if I can recall, being being tired while doing chores, like if our mother told us to do one thing and then another while not taking any rest, that stresses me out. Yes.
Okay, so how do you usually deal with those problems? How do you cope with it?
Oh, I usually watch funny videos just to relax myself.
Does watching funny videos helps you?
Yes.
Okay, that's good. Personal habits, sir. Do you have any personal habits like drinking soda, watching movies, something like that? Can you identify it to me, please?
I do watch movies, but that is not a habit of mine, no.
Any habits, sir, that you do?
Not that I can recall.
So you don't have habits. Do you drink carbonated drinks? Do you like drinking carbonated drinks?
No, I only drink water.
Okay, that's good. Do you smoke cigarettes, sir?
No, not in my life.
Okay, that's good. Have you ever drink alcohol? Do you drink alcohol?
No,
Any use of street drugs, sir?
no.
Okay, that's good, sir. Now I'm going to ask you on how do you think you identify yourself, your health self, okay? Is that okay with you, sir?
Yes,
So, to you, sir, how do you define your health? Are you healthy or normal?
I am healthy for. I don't feel any pain in my body, so I confirm myself as a healthy.
Oh, so you consider yourself as healthy person.
Yes.
Okay, you have health now. Do you have any concerns aside from your headache, of course?
No, not that I can recall.
Okay, what do you expect to happen to your health in the future?
Um, I expect to be a fine, healthy person.
Okay, and what are your health goals?
I really don't have any health goals for the meantime.
Okay, what are your expectations to us, sir? You have any expectations?
I expect to see the problem of my headache.
Okay, we will get to that later. And that's it for this checklist, sir. So now regarding on your headache, sir, I'm going to ask you on when did this headache started, sir?
Mm, about a couple of days ago.
Couple of days ago. Okay. So can you locate where it hurts, sir, on your head? Can you please tell me where does it hurt?
Um, Sometimes it's either the left upper part or the right upper part of my
Can
head.
you show it to me where?
Like it's in this direction or either this.
Like this side or this side?
It's random actually.
Okay, like random. Um, do you have any history of your family from
My
any
mother
disease?
my mother has it too. She said it once to me.
Oh, so what did your mother tell?
I saw my mother once laying in a bed feeling a headache that I thought it was only normal until I experienced it myself. That she told me that we had the same thing. Mm.
Okay, you inherited from your mother, you think?
Yes, I think so.
Okay, so when you are experiencing this headache, how long does it usually last?
From 10 to 30 minutes.
Okay, sir. So on a scale of 1 to 10, sir, how would you describe this headache?
Hmm.
From 10 being the highest and 0 being the lowest.
It really depends on the headache, but I would consider it a 7.
7, sir. Okay. How about patterns, sir? When do you usually experience this? Are you doing something that might let you experience this? Are you tired, stressed?
No, not that I can recall, none.
How does the pain feel, sir? Is it throbbing? Is it radiating?
It's throbbing.
It's throbbing. It's like punching you. It's like
Yes,
spreading. Is that how you feel, sir?
yes.
Okay, good. When do you usually feel this pain, sir?
I usually feel this pain after, well, after I look at my phone for a very long time and don't take rest.
Oh, okay, sir. That concludes our interview for the day. Thank you for cooperation. Is there any something you might ask?
No, I'm perfectly fine. I'm perfectly good with this.
Okay. How about right now, sir? Are you feeling any discomfort? Are you still okay?
I'm fine.
Okay, sir. That concludes our interview for today. Thank you for your cooperation, and I assure you that anything that happens here stays here. Okay?
Okay, thank you.
Okay.